Hello, greetings and welcome to another episode of Being Healthy, the Shaolin Way. Today we're going to talk a little bit more about one of the most dreaded diseases on the planet. No, it's not COVID-19, it's cancer. Now, there are a lot of rumors and myths about cancer that make it hard for people to know what's true about this disease. Here we address some of the common questions people ask about cancer. If you want to know more about how cancer starts and spreads, see what is cancer. If you have questions that aren't answered here, please contact the Cancer Information Specialist at 1-800-227-2345. Now, first, how common is cancer? About 1/3 of all people in the United States will develop cancer during their lifetime. If you want to know how many men and women have the 10 most common types of cancers, there are quite a few. To learn more about the chances of being diagnosed with cancer, you got to consider the lifetime risk of developing cancer. And the risk of developing most types of cancer can be reduced by changes in a person's lifestyle, for instance, by staying away from tobacco, avoiding alcohol, limiting time in the sun, and being physically active and eating healthy foods. There are also screening tests that can be done for some types of cancers so they can be found as early as possible, while they are small and before they have spread. In general, the earlier cancer is found and treated, the better the chances are for living many years. Who gets cancer? Over 1.5 million new cancer cases are diagnosed each year. Anyone can get cancer at any age, but the risk goes up with age. Nearly 9 out of 10 cancers are diagnosed in people ages 50 or older. Cancer can be found in people of all racial and ethnic groups, but the rate of cancer occurrence, called the incidence rates, varies from group to group. How many people alive today have ever had cancer? Today, almost 17 million people alive in the United States have had some type of cancer. Some of these people are cancer-free. Others still have it. Years ago, most people who had cancer did not live very long. That's not the case anymore. Every year, more and more people survive cancer. This is especially true of children with cancer and those whose cancers were found early, before they spread. The survival rates are different for people with different types of cancers. Some types of cancer grow very slowly. Some respond to treatment very well. Others grow and spread faster and are harder to treat. If you know someone who has cancer, keep in mind that what happens to them could be very different from what happens to someone else with cancer. What causes cancer? Things people do. Some cancers are caused by things people do or expose themselves to. For example, tobacco users can cause cancer of the lungs, mouth, throat, bladder, kidneys, and many other organs. Of course, not everyone who uses tobacco will get cancer, but it greatly increases a person's risk. It increases their chance of developing heart disease and blood vessel disease too. Spending a lot of time in the sun without protection can cause skin cancer. Melanoma is a very serious form of skin cancer linked to UV light from the sun and tanning beds. Other things people are exposed to, such as radiation, can cause cancer. For instance, people exposed to nuclear fallout have a higher cancer risk than those who are not exposed. Sometimes radiation treatment for one type of cancer can cause another cancer to grow many years later. This is why doctors and dentists use the lowest possible doses of radiation for x-rays and scans, much lower than the doses used for cancer treatment. Certain chemicals have been linked to cancer too. Being exposed to or working with them can increase a person's risk of cancer. And genes that run in families, about 5 to 10% of all cancers are linked to genes that are inherited from parents. Bottom line, no one knows the exact cause of most cases of cancer. We know that certain changes in our cells can cause cancer to start, but we don't know yet exactly how it all happens. Scientists are studying this problem and learning more about the many steps it takes for cancers to form and grow. But if you're interested in taking steps to help reduce your cancer risk, you can look into how cancer can be prevented, which is our next episode. Can injuries cause cancer? It's a common myth that injuries can cause cancer. But the fact is that falls, bruises, broken bones, or other such injuries have not been linked to cancer. Sometimes a person might visit a healthcare provider for what's thought to be an injury and cancer is found at that time. But the injury did not cause the cancer. The cancer was already there. It is also sometimes happens that a person will remember an injury that happened long ago in the place cancer was found. Rarely, and I say rarely, burn scars can be the site of cancer many years after the burn has healed. Most often, skin cancer is the type that starts in a burn scar. Can stress cause cancer? Researchers have done many studies to see if there's a link between personality, attitude, stress, and cancer. No scientific evidence has shown that a person's personality or outlook affects their cancer risk. There are many factors to look at in the relationship between stress and cancer, though. It's known that stress affects the immune system, but so do many other things. Despite many studies, a link between psychological stress and cancer has not been found. So what are the risk factors for cancer? A risk factor is anything that increases your chance of getting a disease, such as cancer. Different cancers have different risk factors. For instance, exposing skin to strong sunlight is a risk factor for skin cancer, but it's not linked to colon cancer. Some risk factors can actually cause cancer, while others may simply be more common in people who get cancer. For example, old age by itself doesn't cause cancer, but it is a risk factor. Still, risk factors don't tell us everything. Having one risk factor, or even many, does not mean that someone will get cancer. Some people with one or more risk factors never develop the disease, while others who do develop cancer have no known risk factors. Even when a person who has a risk factor is diagnosed with cancer, there's no way to prove that the risk factor actually caused the cancer. There are different kinds of risk factors. Some, like a person's age or race, can't be changed. Others are linked to cancer-causing factors in the environment. Still others are related to personal actions, such as smoking. Some factors influence risk more than others, and a person's risk for cancer can change over time due to factors such as aging or lifestyle. Some of the major cancer risk factors that you can control are tobacco use, diet, physical activity, weight, alcohol use, sun exposure, environmental exposure such as radon, lead, and asbestos, exposure to infections such as hepatitis, HPV, and HIV. Overall, about 1 out of 5 cancers diagnosed in the U.S. are related to excess body weight, physical inactivity, alcohol consumption, and/or poor nutrition, and could be prevented. The question of is cancer contagious? In the past, people often stayed away from someone who had cancer. They were afraid they might catch the disease. But cancer isn't like the flu or a cold. You can't catch cancer from someone who has it. You won't get cancer by being around or touching someone with cancer. Don't be afraid to visit someone with cancer. They need the support of their family and friends. You can get more details on this. But can cancer be prevented? There's no sure way to prevent cancer, but there are things you can do to help reduce your chances of getting it. Tobacco. Many cancers might be prevented if people didn't use tobacco. That's just a fact. Smoking damages nearly every organ in the human body and accounts for about 1 out of 3 cancer deaths in the U.S. 1 out of 3. Cigarettes, cigars, pipes, and oral, smokeless tobacco products cause cancer and should not be used. People who use tobacco should try to quit. Studies clearly show that ex-smokers have less cancer risk than people who continue to smoke. When you quit smoking, it also reduces exposure to secondhand smoke for those around you. It's best to never use tobacco at all and to stay away from secondhand smoke, which also causes cancer even in non-smokers. Alcohol. Drinking alcohol is linked to a higher type of certain types of cancer. Some people think that certain types of alcohol are safer than others, but ethanol is a type of alcohol that found in all alcoholic drinks, whether they are beers, wines, or liquors, distilled spirits, in other words. Overall, it's the amount of alcohol that's drunk over time, not the type of drink, which seems to be the most important factor in raising cancer risk. It's best not to drink alcohol at all. If you do drink, have no more than 2 drinks per day for men and 1 drink a day for women. This may help curb your cancer risk. So drinking and smoking. The combined use of alcohol and tobacco raises the risk of mouth, throat, voice box, and esophageal cancer more than the effects of either one alone. Ultraviolet rays and sunlight. You can lower your chances of getting skin cancer by staying out of the sun. Seems logical, doesn't it? Between the hours of 10 a.m. and 4 p.m. Wearing a hat, shirt, sunglasses when you're in the sun. Using a broad spectrum sunscreen with a sun protection factor of at least 30. Not using tanning beds or sun lamps. But radiation, to learn more about the link between UV exposure and skin cancer, is important. Now on the question of diet. What should we eat? What should we not eat to prevent cancer? We know that our diet, what we eat or don't eat, is linked to some types of cancer, but the exact reasons are not yet clear. The best information we have suggests a lower cancer rate for people who follow a healthy eating pattern, which includes foods that are high in nutrients, in amounts that help you get to and stay at a healthy body weight. A variety of vegetables, dark green, red, and orange, fiber-rich legumes, beans and peas, and others. Fruits, especially whole fruits, with a variety of colors. Whole grains. It also includes, or does not include, red and processed meats, sugar-sweetened beverages, highly processed foods, and refined green products. We have a lot of information on how diet and physical activity can affect cancer risk. Does sugar feed cancer? Is a good question, and a valid one. Sugar intake has not been shown to directly increase the risk of getting cancer, having cancer spread, or having it get worse. In other words, to progress. Still, sugars and sugar-sweetened drinks add a lot of calories to the diet and can cause weight gain, which is linked to cancer. We know that some cancers are caused by infections, mostly viruses. One virus that's clearly linked to cancer is the human papillomavirus, HPV. In other words, it's been linked to cervical cancer, anal cancer, many genital cancers, and even head and neck cancers. There is a vaccine series to help protect against HPV infection and the 6 types of cancer it can cause. Young people who are not yet sexually active can have a risk for certain type cancers later in life if they get the HPV vaccine before they're exposed to the virus. The American Cancer Society recommends the vaccine for girls and boys between ages 9 and 12. Children and young adults aged 13 to 26 who have not been vaccinated or who haven't gotten all their doses should get the vaccine as soon as possible. To learn more, we shall talk about it in the future. Early detection. To find cancer early, while it's small and before it is spread, adults should have regular tests called cancer screening tests. These tests help healthcare providers find common cancers before they cause symptoms. For example, regular screening can find cancers of the breast, colon, rectum, cervix, mouth, and skin early. If cancer is found early, it can be easier to treat. Survival also tends to be longer for those with early cancer. Talk to a healthcare provider about which screening test might be right for you. You can learn more about things you can do to help find cancer early in the American Cancer Society guidelines for the early detection of cancer. How is cancer diagnosed? A person's signs and symptoms are not enough to know whether they have cancer. If your healthcare provider suspects cancer, you will need more tests such as x-rays, blood tests, or a biopsy. In most cases, a biopsy is the only way to be sure whether cancer is present. To do a biopsy, a piece of the tumor or abnormal area is taken out and sent to a lab. Therefore, a doctor who specializes in diagnosing diseases, called a pathologist, looks at the cells under a microscope to see if cancer cells are present. If there are cancer cells, the doctor tries to figure out what type of cancer it is and how fast it's likely to grow. Imaging tests can measure the size of the cancer and can often show if it has spread to nearby tissues. Blood tests can tell providers about your overall health, showing how well your organs are working, and give information about blood cancers. How is cancer treated? Surgery, chemotherapy, and radiation are the 3 main types of cancer treatment. A person with cancer may have any or all of these treatments. In choosing a treatment plan, the most important factors are generally the type of cancer and the stage of the cancer. Other factors to consider include the person's overall health, the likely side effects of the treatment, and the probability of recurring cancer. Controlling it to extend life or easing symptoms. Surgery. Surgery is often the first treatment used if the cancer can be taken out of the body. Sometimes only part of the cancer can be removed, and sometimes there may be risk to doing surgery for a cancer diagnosis. Radiation or chemotherapy might be used to shrink the cancer before or after surgery. Chemotherapy. Always a difficult choice, but doctors use chemotherapy or chemodrugs to kill cancer cells. Usually, the drugs are given intravenously, IV into a vein, or taken as a pill by mouth. Chemodrugs travel throughout the body in the bloodstream. They can reach cancer cells that may have spread away from the tumor. Radiation therapy. Radiation therapy is treatment with high energy X-rays to kill or shrink cancer cells. The radiation may come from outside the body, called external radiation, or from radioactive materials placed right into the tumor, internal or implant radiation. Getting external radiation is a lot like getting an X-ray. So other types of cancer treatment. There are systems like targeted therapy, stem cell or bone marrow transplant, and immunotherapy. Hormone therapy is another type of treatment that's sometimes used to treat certain types of cancer. Clinical trials are studies in which people volunteer to test new drugs or other treatments. In cancer treatment, in particular, clinical trials may be used to learn whether a new treatment works better than the treatments used today. For instance, clinical trials are used to see if adding a new drug to the standard therapy makes it work better. In studies like this, some patients get the standard drugs, which are the best available at the time, and the new one being tested, while other patients get the standard drugs. Clinical trials are one way to get cutting-edge cancer treatment. How do doctors decide how to treat cancer? Is a good question, and it's a question that deserves a serious answer. Doctors consider each patient as an individual with personal preferences, and then make recommendations based on things like their own personal experience, current research, the goal of treatment, and current cancer treatment guidelines. One source of guidelines is the National Comprehensive Cancer Network, an alliance of leading cancer centers around the world. Panels of experts from these centers, they sort through the research evidence and combine that with their own knowledge and experience to come up with the best available treatment options for each cancer, and usually for each stage and characteristic of a person's particular cancer. These findings are published in NCCN Clinical Practice Guidelines in Oncology, which provide a standard for care in the field of oncology. The guidelines address cancer treatment, cancer detection, risk assessment, and reduction, and support care. They are updated on a regular basis. Now, that's all for today, but tomorrow we'll continue our discussion of cancer and what the options are for cure. But in the meantime, you can find us at healthyshaolin.com if you care to check in on us. And if you would like to learn more about the monks of the Shaolin Temple, you can do that at shaolintempleus.org. Until then, peace and blessings be upon you, and namaste.